The real determination is made on the front end with a high quality evaluation. If we can have an individual and their family come in for a comprehensive evaluation, we can really provide them with a comprehensive range of alternatives that would oftentimes include outpatient treatment. When we can put together a plan for someone who has a moderate to severe form of this illness that allows them to stay in a comfortable environment, we find that it pays dividends because they're already to some degree reintegrated into society. Residential treatment programs can take you away from that and then really have kind of a time reintegrating and starting over, and how do I reestablish myself in terms of work and my career. We really focus on putting together a plan on that front end. If an individual meets criteria to participate in an outpatient program, we work to make it affordable and highly comprehensive so that they get what they need and not have to go away. We have so much information now from the medical community, scientific evidence that addiction is a disease. It's often referred to as dopamine deficiency syndrome. It's an actual place that we can now locate in the brain, in the reward center, that has low levels of the neurotransmitter dopamine. Whether we are born this way or whether we acquire it is to some extent irrelevant, because the treatment is to supplement that neurotransmitter chemical in our reward center, amongst other neurotransmitters. But we learn the behaviors and the tools necessary to naturally supplement this reward center that is deficient in a chemical that can be measured. Experimentally has been done so and written about in the scientific journals. We also understand that it is hereditary. Not everybody who has the disease does have a first-degree relative with addiction, but we do know from twin studies conducted through the VA system that there is a genetic component to this condition, similar to other chronic medical illnesses that we might be talking about, whether it's an autoimmune condition, whether it's diabetes. We do know that this disease carries genetic risk. We appreciate on the front end having a support person with the individual in order to help them along the way of deciding to enter treatment. It's not an easy decision to enter treatment, and our hats are off to the folks who do come in, because it takes courage to change and to enter the unknown, if you will, if they've never come to treatment before. We want to be that welcoming hand and that warm presence that helps them along the way, but also provides them the professionalism and the guidance that they need to be healthy and reach their full potential. So we're really thankful when an individual can bring in a family member or support person after they are individually evaluated by the addiction medicine physician. The family is often brought in after the evaluation to basically discuss what has been discovered and to help them implement the plan that is recommended.